instruments. Really, I graduated from university and I doesn't know. This is the reason I am choosing for you the instrument in oral surgery, the instrument which is local anesthesia, the instrument which for opening the mouth. There is instrument for to incise, to cut. There is instrument to elevate the mucosa when you are using the knife. There is instrument to retract you to when you open the flap, to retract the flap. If there is bleeding, there is instrument to stop the bleeding. There is instruments to catch the flap and move it right and left. There is instrument for grasping, instrument for bone elevation, chisel and the mallet, instrument for bone fixation, screw and drive. You put the bone and you fix it with a screw. There is instrument to remove soft tissue from bony defect. If there is bony defect, then there is instrument for suturing. You saw it. Rotary instruments and tooth forceps and elevator. We already talked about it. Okay, now we are going to see what is the instrument for local anesthesia. You saw the instrument: anesthetic syringe, anesthetic cartridge, and needles. All right, Ani? An.
Yeah.
This is the cartridge. Okay, it's called cartridge, anesthesia syringe, or anesthetic. This is the anesthetic syringe, and this is the anesthetic cartridge, and this is called the needles. The needles have small and medium and long. The long we are using it especially for the lower inferior alveolar nerve for regional anesthesia, long distance. The short we use it for infiltration, anterior and the area which need infiltration. The needles, so we have number 25 short, number till we reach number 35 to 37 millimeter long. This is the needle long. How you fix it? You put your needle inside in this way, turn it. Okay, once you finish, there is different kind of, you have to take this one back and open. All right, it's easy. You put your cartridge inside, push it, and return it back, and you are ready for. You press little because you have to check if the water coming out or no. If the water is not coming, that means the needle is blocked. Change another one. All right. So this is the cartridge.
So first you must do the needle fixation, or first
Whatever you want, whatever. But better to put the needle and after you put, because what's happening, if you sometimes you put this one and put the needle, if it is not inside, it will be tight. You can do both, no problem. Okay. So anesthetic syringe. It could be a plastic also. No need for metal. This we use it in routine our work. Non-aspirating syringe, we have two kinds: aspirating and non-aspirating. The aspirating syringe, like this one, have a tooth inside. It will go inside the plastic, and once you take it back, if there is blood, you are in the blood vessel, the blood will come inside. Then you have to change the position. All right.
Yeah.
And non-aspirating, this one will be straight. All right. Always you use the aspirating one to see if there is blood inside or not. Because if you inject inside the blood vessel, hematoma will happen, and it is painful also. You will see his skin become blue. All right. This is the type of aspiration, like this. All right. So the way of injection, your finger are like this and like this. Okay. This is the way of handling. The aesthetic cartridge could be a rubber, rubber vasoconstrictor. This is the cartridge. This is the silicone rubber inside. This is the rubber which move and press. The glass cartridge. The anesthetic solution is either normal saline or Ringer lactate. This is for, and there is a ingredient is medicine for not becoming toxic with the time, for conserving the medicine inside. We have amine type and ester type. One is lidocaine, is metabolized in the plasma, and the articaine, which we are using, this one is metabolized in the liver. Okay, these both kind are used in local anesthesia. The needle, I talked to you the links about it. This is the between 25, 27, 30. He's telling you the size of the needles also. Okay. This is the shank, it is third, and this is the attached between the needle and this plastic. This yellow one and here. And this is the bevel is important. When you inject, please 3-4 times, don't try, because this bevel will become angled and it will be painful during insertion. So it's better if you do it 2 times, 3 times, 4th time you change it, put new one. All are disposable needles. We have mouse probe and mouse gag. You will see this is the one to open, because many children they will not open the mouse. So you have these devices available in the market. You put between the 2 teeth in the occlusion, and his mouth will be open. You work on the other side. Mouse probe. Okay. Yes. Mouse probe. It's the name. And you have for surgery in general anesthesia. I use this one. This also use it by the ENT. But this one I use it in oral surgery, because during general anesthesia the patient will not open the mouth. So I push this one, and this will open the mouth of the patient. All right. We use knife. This is the knife and this is the blade. We have number 15, this one is the most used, and we have number 11. This is number 13 or whatever be. Each one have a work to use. This, the most we use this number 10 and number 11. There is number 15 is smaller than this one. There is different kind in the market. You have 2 kind of knife holder. This is blade holder. This kind routinely, and this one is long. All right. Now we are speaking about if you use the knife, okay, you cut. After that, we have to open the flap. This is elevator, periosteal elevator. موبايل سمحاق بيسموه في العربي. Okay, periosteal elevator. To open, you did incision after. This is different kind. Periosteal elevator, and this is Remus stripper. It is sharp. Once you are in the bone and you want to open the place, you use this one because it's have sharp edge. And this is a hook. The hook, we don't use it much. Only once we are going to suture a wound, we put the hook in one side and we start suturing. All right. Instrument for retracting soft tissue. Now I want to remove wisdom tooth. How I will do? I can't. The patient opening his mouth, I have to put retractors. Now you are going to see retractors. This is different kind of retractors. This one we use it for sinus lift for upper maxilla. This retractors, periosteal elevator, or retractors also to open the flap and start working. It's mean retractors عملية شد. Okay, this is the reason it's called retractor. See, if I want to remove upper wisdom tooth, I am using this one. I put in the back and I tear the الخد, أشد الخد, and I remove the wisdom teeth. Like there is different type of it. You have the one which is 2 up. This one is called Oberger retractor. Oberger retractor. German companies manufacturing this one. This one, especially they use it when they are doing Lefort 1, Lefort 2 orthodontic surgeon. I use it, this one, I have it here. I will show you now when we finish. I use it for removal of wisdom teeth because it is too much up and it is impacted inside. Look, this is different kind. Okay, all are called retractors. This you use it for wounds, suturing. If you open here for fracture mandible or something like that, you use it. This is a hook. This is for plastic surgery. When you are doing Z-plasty or what, شلت حبة أو كذا, this one to take the skin and you do nice suturing. This one for the chin. If you are doing chin plastic, this one will go inside below the bone and will open the lip down. Okay, this one is especially for chin retractor. You see, I didn't read it, but this one is only for that purpose. This one is for also the orthodontic surgery. Okay, see, he is protecting with this one the inferior alveolar nerve. When they are doing osteotomy to advance the jaw or take it back, orthodontic surgery, all these instruments is used for orthodontic surgery. See, this is in case of fracture, mandible fracture. This is condyle fracture. This is bony fracture, and see, all these instruments are used to approach the bone and approach the flaps. Each one have a special work. This is instrument for retracting soft tissue. See, each one, this is orthodontic surgery. The Lefort 1 fracture they are using by chisel and mallet. You will see. Each one have special, look, when he fractured, he used it مشان يسلخ العظم عن بعضه and bring it in front. This is tongue depressor for take the tongue far from the area we are working. This one, retracting soft tissue. Soft tissue, the tongue is soft tissue. This kind is called for controlling hemorrhage. You know, when we open a wound here or wherever and there is a bleeding, then we need, like this one, the hooks are very small pin. You take the vessel and press it. اضغطوا على الوعاء. Okay, to stop the bleeding. It has straight type and they have curved type. This is the curve and this is the straight. Two types, yeah. This one is called mosquito or hemostatic forceps, or hemostatic holder. This is called tissue forceps, or they call it Addison forceps or Alice tissue forceps. In Europe, everybody know it. It's Allison tissue forceps. There is a tooth and it's clip. Okay, this one we use it to take the tissue and suture it. Last time I show you. It's have teeth, no teeth, and here teeth. This one is called Alice tissue forceps, also to take the tissue or catch if there is a worm, tumor. This one catch the tumor and you start cutting it. All right? Instrument for removing bone. Okay, now we have, this is called Ronger. Ronger forceps, but قطع. You take, if there is, you open a wound and you see the bone is not correct, you take like it will cut all that chips. Different kind, small type, big type. This one is chisel and the mallet. When you are doing you want to do orthodontic surgery, there is unilateral or two lateral bevel for cutting the bone. Okay, and this is the mallet to frap it, cutting. Many doctors they remove wisdom teeth with this one, with this instrument. Okay. See now when he did the line of fracture, he put the chisel and the mallet مشان يفرق العظم بيناتهم. Osteotome. It is called osteotome in English. This one also is osteotome, different type. You see, this is the طريقة تسليخ العظم to advance the bone front or back. First, orthodontist will do to you study. He will tell you how much millimeter you can advance and return the jaw back. So by using this chisel and mallet, this is called orthodontic surgery, you can advance according to the study. and you put if the jaw is back, you advance it. If the upper jaw is front, you can take it back. And after that, we fix by plates and screw. Okay. Look, maybe for you it's not important, but at least I want you to see, because nobody will explain to you this kind of instruments. It's a surgical, professional instrument. Okay. See now how he's entering and putting this tuberosity of the mandible. Yes, to advance the jaw in front. Okay. Yeah. Now, sometimes after extraction, we have points. The alveolar bone will come مثل دبوس. يعني if you suture, if the patient put the prosthesis, he will feel something picking him. So you take this one, you see it's مثل مبرد. And you grind it like this by hand and wash it, wash it, and after that you suture. Then it will be smooth. Yeah. This one is called bone files. Okay. And this one is, we have two fracture here bone. Then when we open to reduce the fracture, we take this bone and this bone, we approach it together and they put together.
Yeah.
Okay. Yes. Instrument for bone grasping, it is called. Why? Look, it have two teeth here. Okay. Now I have this instrument also. It is expensive. This one for when there is a Lefort 1 or Lefort 2 fracture. This one we enter in the nose, and the lower will come in the palate. By this movement, right, left, you put the jaw in place and you close the teeth, and we put plate for fracture. I use it too much.
But it will not hurt?
No. It not. The patient is under general anesthesia when you use this one. Look, this one they are using for, this is the condyle fracture and to approach it, okay? And this one, this is the instrument. You fix, and after you put a plate, not to move, all right? This is the way of using. I told you each instrument should be available, because you don't know this fracture, you need this one or you don't need.
Yeah.
This one, maybe I use it more than 100 times. This instrument is called bone elevation for zygomatic hook. This bone, when it is fractured, this is the zygoma. This is the eye, this is the zygoma. When somebody is heated here, fighting or dashboard, this bone will be fractured and gone back. Once it is gone back, it will press on the coronoid process, and the patient cannot open the nose. He will come to you, he can't open. So what we do is this hook. I just put the hook inside. Put your finger here. See? You put the hook inside here. Take it up and bring the bone which is pressed. Bring it in front.
Push it out.
When you push it out, see, he's telling you this bone. في اتصالات هنا, sutures. The bone will come in place.
You do force here?
If here is moving, this bone is moving, then you have to open here. And we put a plate, 1, 2,
3.
Yes, 3 plates. This one not necessary, but this necessary and this necessary.
And this one?
No need,
No need.
because this is the arch, zygomatic arch. It's difficult to enter, dangerous. Okay. This is for this. Look, there is 2 types to reduce this bone, either by hook or we use both. The second type, we open here.
Temporal.
Yeah, on the temporal, you go inside the temporal. Temporal. No. Fascia. Temporal fascia, and all muscles have fascia.
Yeah.
You just do little incision in the fascia, and you go between the muscle and the fascia. Immediately, that fascia will lead you here, because you know the temporal is attached to the coronoid process. Immediately, will go down. See, once it is gone down, this one will go down, and this one is outside. You put your hand here and push it. What will happen? Yes, you do it like that, and this one will come out. Yes, take it out, and this bone will come out. I use it. I have it. This one also. Zygomatic elevator. This one is more easier and guarantee will do you. That hook also, sometimes if you are in hurry, just put the hook and take it. If the patient opened his mouth, then it's okay. It's not, he doesn't open after 4 or 5 days, it will become difficult. Then you have to use this one. Okay? These are all for zygomatic elevator, for zygomatic bone. For bone fixation, if you have the jaw is broken, this one is called Eric arch bar. We fix it on the upper and the lower teeth, and this is the wire. Usually we use 4-0 wire or 3-0 wires. It's soft wires. Ay,
Կներեք, այդ հիվանդի կարակ զանգեք, ասեք մի քիչ ուշ կա։
ay uş bilika artık.
Չէ, որ ասեք 3-ին է գալու։
Ha bilika gerek karot ans bilika.
Չէ, տղաները ասում են կարակ, ասեք 5-ին 5 կես կա։
Ezan kemeren nasıl?
Քանի շուտ է էլի։
Kamiyeni sanırım.
5 կես։
Açı ver çasırı.
Չէ,
No.
խոսեք տեսեք ինչ կասեն։
Çertivi. Sağ.
Չէ, սալպին չէր։
Sabrinço.
Չէ, Տիգրանուհի չէր։
Ha abris.
Դուք հետ եք, Տիգրանուհի էր։
Bir kat gına istiyorum.
Մենք ուրիշ գործ չունենք, չէ՞, լաբորատորիայում։
Sarpıyor ya.
Սալպի, մի րոպե։
Sesi dikranıyor.
Բաս։
Sesi na iş değil iftiracı benim. Çünkü cam yerken o beni hasta.
Չէ, էսի չի։ 15։ Այսօրվանն է։
Այսօր ինչ է, cam yerken. Dikranıyor ya. Ve katı.
Հա, այդ Տիգրանուհու ժամը փոխել։
Da. Tüve hasta da. Diğerine ayrı.
Ոչ չեմ հասկանում, չէ գրել։
Diğer şu eski var mı? Ayşe.
Գողես։
Şu eski.
Զրո 41,
Aynen.
71, 76, 77։ 5 կես էդպես տեսեք կարակը։ Դուք ազատ եք 5 կես։
Bir bakma. Burası gerek şey.
5-ին ով։ Ուզում եք 6-ին ասեք, թող այդ ազատ է։
Geçin.
6-ին ասեք։
Alo Parev. Dikranühi ne? Ne desin? Doktor Beş ne khoso? Obe. Dikranühi gizan kimdir? Sıkhalem. Ya mersi ki. Güneriz.
Չեք գրեի դա համարը։
Yeşil bunlar bizler.
Տիգրանուհի հեսա։ Հա, նույն համարն է։
Lavnayım 0 me.
Ահա, 76։
Ha, da yeşil to me.
Ահա, սխալ եք։ Տվեք ես հավաքեմ տա։
Sevecini. So this one we use it when the jaw is fractured. We put the teeth and we fix it. Eric arch bar. Any jaw fracture, we use this one. The Eric arch bar should be available in all oral surgical clinics. Parev Dr. Bersne. Nair hima inzi laboratoire lurde va asi vecina araç çiverçena porsiya hamar.
6-ին։
Uzes vecin gamuruş otmayın. Da va yet uzes se va çörek şaptı ardın da sen mi çep çors olsan. Dan şatla bispas. Va da su vesin bispas. Ya ser bay bay.
10-ին
Da su.
Տիգրանուհի։
This one we use it. This is this
Merci.
one. Yeah, merci. Wire cutter. This one, if the upper jaw is moving or something like that, we enter. We open here. We put wires and we go down. We put arch bar on the jaw and we fix it, and we stabilize the jaw movement. This one, it will open a road. You can enter here, you can enter there. You see, it's a pin. If the jaw is broken with the children, we do a device in the oral cavity. We enter with the pin here. In the oral cavity, ناخد السلك, the wire, and we do circumferential wiring. It's special oral surgical
This
instrument.
instrument for maxillofacial, yeah?
For maxillofacial, yes. All now maxillofacial, professional. Look, if the jaw is broken, this is the way of approaching. You put the edge to edge and you use the, look how it is. When you approach, you put the screw, the bone will be fixed. Okay? He's telling you how we are using it. This is the screw. All this is the plate to stabilize bone fractures. You can use it. And this is a screw. Usually we use 7 millimeter bone screw. There is different kind of plates, L shape, X shape, like these shapes, according to the fracture line. Okay. This is the curate after extraction. There is difficult angled or straight. This one we use it generally for the lower teeth, and the straight one we use it for the upper teeth when you are doing curating. Okay, the curate is important, especially if there is a periapical lesion or whatever be. The needle holder. This is the different kind of needle holder. This is available in the market. Usually, this one we use it for plastic surgery. Small needles. This is the needles we talked already. We have the round, we have triangle. This one, in the past we were using this one, دخل الخيط من هون, or before it was not coming sterilized like that. We take it, we put inside, and we send for sterilization. The needles are still till now it's available, and you have the straight needles also. Okay. This is the shapes, cutting round. The round one we use it for suturing. Submucosal, this one for suturing the mucosa. You see different types are used, and we talked about last time. We talk. I gave you the chromic, the catgut, and things like that. All right. Dental burrs. This is the instrument we use for surgery. The straight handpiece, the curve. All these instruments are used for that. For removing wisdom teeth or for surgery. This is the instrument for, this is for doing hole inside the bone.
Yeah, drill.
Drills, phrase we say.
For implants?
Phrase or burrs. Burrs. No, this one we use it for doing hole in the bone to put the screw for fractures. Okay. Dental elevators, we talk it, you saw it, we have different types, straight for the lower teeth, for the, yes, we talk about it. This is the forceps, this is for the upper, all right, Pedo-American pattern, it's different type. This is for the upper wisdom, this is for the lower wisdom, this is for the roots, lower. Once it is like that, it's for lower. Once it is half, it is for the upper, okay? You remember that one. This one is for small roots. Different. You should have it because maybe one time you need it.
This is for small part.
Yes. This is for cutting the shash, the gauze, yes. This, and this one for cutting wires. Yeah. All right. Each one has. Yes. This is for. This is suction tips, different suction tips, and this is for irrigation. This is for implant, I think. Or, no, for suction maybe. Suctioning. So, suctioning يعني مصة لعاب. Okay. Enough today. Next week exam.